Did you know that people with dissociative identity disorder are more likely to harm themselves than others? About 70% of these people have attempted suicide. We will be discussing chronic dissociative psychopathology, which often develops due to severe childhood abuse. But before we get started on multiple personality traits, here is Myers Briggs in a news flash. First, we know that you come here for MBTI personality types. Therefore, this question is likely in direct response to your obsession with Myers Briggs. Well, multiple personality traits in MBTI are not possible. Everyone has one type that they fit. However, sometimes it can be challenging to find your kind. For instance, if you look at the negative traits in cognitive processes, you will find your type quicker. When we take the test, we look out for what we aspire to be. We subscribe to many things due to the kind of upbringing we have. Speaking about upbringing, we face some challenges as children that determine what personality traits we form as adults. Yet it is impossible to share two or more MBTI personalities. We conclude that if there is one personality for you, you can find it if you read the negative cognitive functions carefully. We will shed more light later. Stripped away from judgments and punishments, our natural state is what remains. Thus, one must search within. Additionally, do not seek the things you are good at. Instead, the things that come naturally to you. Further, some people were born to be thinking and judging. Yet, if they were on their own and free to choose, they would be feeling and perceiving. As well, people are adaptable creatures. We grow and adapt our behavior to circumstances around us. For example, a parent can start with a thinking preference. Still, once they start taking care of their child, you find them leaning towards the feeling preference, where they ensure that the child is well taken care of unconditionally. Accordingly, when you receive the test and are within two personality types, you can reduce the letters to 3. Cancel out the last letter of each personality type you received, and then read the cognitive functions remaining for the 2. You will then realize that you are leaning towards one and more. Remember to go with who you are instead of what you aspire to be. For some people, what they desire has no link with who they indeed are. Their response to a past event like trauma or abuse is to detach and suppress the memory. As a result, they form alternative personalities that do not share the history of said abuse. We will present more on this when we get into the causes of dissociative identity disorder. Nobody can have multiple MBTI personalities. However, other kinds of multiple personality traits could be diagnosed clinically. Before we go any further, do not forget to subscribe to this channel for more updates on personality matters. Author David Mitchell once said, "The art of the novelist is not unrelated to the illness of multiple personality disorder. It's a much milder form, but the better the book, the nearer to the padded cell you are." Some people have multiple distinct personalities that control them at different times. People with dissociative identity disorder have a history, traits, and preferences for each character. Of course, these identities could be of various genders, ethnicities, and interests. Moreover, they are prone to hallucinations and gaps in memory. Statistically, women are more likely to be diagnosed with DIT than men. While the condition affects 1% of the global population, it can occur at any age. You might have heard the term personality disorder. Might consider that and DIT as similar. There are 10 personality disorders, namely antisocial personality disorder, avoidant personality disorder, borderline personality disorder, dependent personality disorder, histrionic personality disorder, narcissistic personality disorder, obsessive-compulsive personality disorder, paranoid personality disorder, schizoid personality disorder, SCHIZOTYPAL personality disorder. The difference between a personality disorder and dissociative disorder is that the former is a long-term pattern that differs from what is usually expected in social circles, while the latter involves problems with the following psychological functions: sense of self, behavior, perception, emotion, memory, identity. Some of the symptoms include self-harm and suicidal thoughts, delusion, depression, memory loss, drug and alcohol addiction, disorientation, anxiety. How does it feel to live with someone who suffers these symptoms? When should you be worried and call a doctor? And when should you give them space? Share if you have any experience to help others in the comments below. What happens when someone is diagnosed with DID? Symptoms may not be identified until late into adulthood, although they may begin as early as 5 years. They may be confused about other children's behavioral learning problems, including ADHD. Nevertheless, psychotherapy is the resolution for multiple personality traits. Aside from that, hypnotherapy could also be suggested to recover suppressed memories. A specialist guides the patient into 3 significant milestones. They are identifying and working through past trauma, managing the sudden behavioral changes, merging the separate identities into one. Dissociative identity disorder has no cure and cannot be prevented. Meanwhile, the symptoms can be managed with proper professional guidance. Also, stress and substance abuse are the 2 leading triggers that invoke alters controlling your behavior. To recap, one cannot have multiple MBTI personalities. Yet, multiple personality traits are common mental health disorders caused by childhood abuse and traumatic experiences. Elsewhere, we have a video on another person who needs their childhood trauma explored. Check out our video titled How Vladimir Putin Mastered the Art of Silence, ISTP and Silence.